everyone. Good to see you. We're going to go ahead and get started. Lyndon does need to leave at 5:30, but I thought we would start with some introductions as a part of our call to order. So as Amy calls the roll, and introduce yourself and kind of tell a little bit about yourself, perhaps, where you're presently employed or where you were employed or something like that, so we can all get to know each other, since we have several new members. So I'll go ahead and turn things over to Amy to go ahead and get the meeting started.
Can you just do one by one?
Yes, thank you.
Dr. Krista Jones.
I am the director of the University of Illinois College of Nursing, and I was a previous employee of the Champaign-Urbana Public Health District for a number of years, and have been a member of the Board of Health now for 10 years.
David Dees.
That's me, I'm here, and I am a lawyer with Butler and Dees in Champaign, who just moved. And I don't know how long I've been on this.
A while.
I was hoping we were.
Four terms or so.
I remember when you came on.
He's more senior, I think.
I'm
the senior in many ways.
He's just been here a little less long than me, I think. Maybe not. You were here when I wasn't even the administrator.
No, I had to write a letter of recommendation for you.
I know.
I've been trying to withdraw that.
Kathy May.
I'm here. I'm retired from healthcare. I worked for about 40 years in healthcare doing strategic planning, business development, and marketing, both for Carl and for what is now OSF.
Dr. Peterson.
I am a physician, essentially retired, although doing volunteer work. Trained in internal medicine, but ended up doing emergency medicine for 25 years, and at the same time, addiction medicine for more than 20 years. It's still my interest, addiction medicine, and that's how I got involved with the public health department. I've been on the board, I was thinking about that last night, since 2003.
Dr. Goodley.
Hi, this is Lyndon Goodley. I'm retired from the University of Illinois a year and a half ago. I'm loving it. I do officiate basketball on the side, so sorry I have to move out at this at 5:30. Been on the board, this is my second term. And I think is it 3 or 4 year term? I don't remember.
It's 4.
4 years?
We don't know. We try not to let you know when
Okay.
the terms are. We try to choose. Hot overdue, right? You'll get a call about your extended warranty on here.
Dr. Rushton.
Just introduce myself.
Yeah.
So, Brent Rusak, I'm medical director of the Children's Service Line at Carl Foundation Hospital. Been on the board for 3 years. I served a partial term and then started my second one.
Dr. Sherman. Dr. Sander.
I'm Will Sander. This is my first meeting, but I am a veterinarian. I have an MPH degree as well, and I direct our DVM MPH program at the College of Veterinary Medicine at the University of Illinois. I've been there since 2018. Previously did stuff with EPA and the Department of Defense in Washington, D.C.
Welcome.
We always have a lot of your students over here.
Beth Clarinant.
Vantage there or not?
Vantage or not?
Vantage there or not?
Vantage or not?
You got it.
Okay.
Or you can just say that.
You go by
After I make you do all that.
You go by Beth or Bethany?
Beth.
Beth. Yeah. Thank you.
I'm from County Board District 5. I've been there since 2021, and this is my very first day.
Wow.
Baby board member.
We are excited to have you. It's been a while since we've had someone on the board from the county board, so we're excited to have you here.
Awesome.
Did we get everybody then? Is that everybody? All right, terrific. We're moving to approval of the agenda, but I would like to request if there could possibly be an addendum to the agenda to reorder the agenda so that we can take care of business items 4, 5, and 6 underneath H, because Lyndon needs to go, so those are some action items. So if someone would please introduce that as an addendum. Or, I mean, I'll go ahead and make a motion to approve the agenda, and then if someone would second that, then we can introduce that as an
Second
agenda.
it, but do you want a motion to change it?
Yes, please.
I move to modify the agenda as you stated.
Thank you. And do I have a second to
Second.
that? Thank you. Moved and seconded. So we're voting on that to change the agenda. All those in favor?
Aye.
Thank you. And now we'll move to voting to approve the agenda with that change. All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you very much. That takes us to approval of minutes. So I'll entertain a motion to approve the minutes.
So moved.
Second.
Moved and seconded. Any discussion on the minutes?
Where are they?
We are on item number D.
Yeah, but where are the actual minutes?
They are included in the packet. Did you receive the packet via email? It would have been emailed to
Looks
you.
like this.
Usually we
It's up here,
email
we
them
can roll
out,
it,
but,
yeah.
yeah, we do all.
Yeah.
We usually email them out, but if you want a hard copy, you just need to let us know, and we can mail it out.
It was 96 pages this time.
That was a big one.
And you could eat a factory with it. The boilerplate was significant.
There was a lot of work.
Yeah, they come out from AIM, and then this last time you would click on the link, and then the link would take you to a code. You enter that code, and then that gives you access to the pages.
Then I have to answer the questions 3.
And are you able to, thank you very much.
Very good.
What's happening? What are we doing?
We're just waiting, I'm making sure she had an opportunity to look at them.
Okay.
And if you'd feel more comfortable abstaining because you
Yeah, I
wanted this
think,
meeting,
yeah.
then
Yeah.
that's comfortable as well. So we have a moved and seconded. Any further discussion on approval of the minutes? Hearing none, all those in favor?
Aye.
Anyone opposed? And then one abstention.
Oh, so you said as well.
Two abstentions, thank you. Okay, so then that takes us to H4. So approval of the Champaign County contract between the Champaign County Public Health Department and LA Department of Public Health for the Comprehensive Health Protection Grant, FY 2025, in the amount of $185,200.50 for the time period of June 1st, 2024 to June 30th, 2025. And for those that are newer members, any contract that the Board of Health or CUPHD in conjunction has the administrative body of the Board of Health would enter into that would involve county residents, this body must approve. So from time to time, we'll see these contracts come through. There are quite a few, I think there's 5, maybe 6, that, between the Total Grant and other ones.
This is, although this is the big one, and they've started, it's comprehensive now, so they've started just shoving everything under one grant, so I don't know if there'll still be some for Whitney and some other ones, but they shoved them all under this one now.
And the full body of that entire grant is pages 16 to 69. So that took up quite a bit of the 96 pages.
Yeah,
for computers.
and just for the
Yeah.
record, most of that is boilerplate stuff at the end that they tack on. It's the same all the time, and there's a ton of it, but it's always that big, like the actual part of what we're doing is like 2 pages. and
This
then
was
it's all-
actually a little longer than the rest of them. The deliverables were easier to find.
Yeah, because and they actually put the
It's
different
about 8
grants in there.
programs, right?
Yep, yep.
Yeah.
Any major changes we should
I don't believe so. There's nothing different than,
I'll move the approval, and then I'd like to discuss it.
Yes, please. Okay, we been moved and seconded. Thank you. Been open for discussion.
So, looking through this, I was impressed with pre-exposure prophylaxis was a large item there. And I don't think we've really talked about that much in open session, so.
Probably not.
Could we have a presentation at some point on what's being done there, or?
Yes. I will have Candy come in, or somebody from Candy's division come in next time. That is what we're talking about,
Yeah.
correct? The prep grant.
The prep, right?
Yeah, it's, you know, we were just talking about this before the meeting, that we're getting close to, you know, actually getting to zero, if you will. And then with the new administration, it's not looking like that will continue, so that's scary. But yeah, we do a lot of that and a lot of programming around that and for a large area. So yeah, we'll put Candy to come to the next meeting and
What
talk about it.
exactly is that?
Pre-exposure prophylaxis. So if you are a person who is at risk for HIV, or, so that can mean you're in one of the, you know, you're a person who has sex with other men, you're a person who has sex with a partner who is HIV positive, if it, a whole variety, there's a whole list. And what you can do is you can take the pill, Truvada, correct? Is that still what it is? Because I'm out of that world now, but Truvada. And you take the pill, and it's part of a program. There's lab works that have to go with it, like every 3 months, and you know, counseling. You're hooked up with a case manager, and there is no. If you take that, there is basically no reason for anyone to pass HIV or to get HIV. If you're virally suppressed, doctors feel free to chime in. But if you're virally suppressed because you're taking the medicine, there's no reason for you to be able to pass it on. So we're just in a completely different world now, and now they're working on, you know, the shots. We have the shots too, I believe, and it's just amazing. I mean, it's amazing because I started out in this, and it was condoms were kind of cutting edge back then. We just didn't have anything, so it's just amazing. And so we have a huge program. We were, of course, one of the first in the state outside of Chicago to get on it and adopt it. And so Candy will be able to, I'm sure, give you an update on where that is, how many people are getting it, how we do outreach, all that type of stuff.
And does the prep, does that cover also doxy prep or just HIV?
So the doxy prep, you mean for STDs, right? I don't think it's part of that grant, but we do it.
Okay.
Yeah, we do that, but I don't think that it's part of that grant. I think that's exclusively HIV. So, I mean, we do things that aren't a part of a grant, but.
Right. I think it probably would benefit the group just for their information if she would touch on that when she presents, just so that even if she's clear that, oh, that's not part of the grant, but that's also a service that's provided.
It is, and probably it would be good to have her, because she's never here because there's not a specific program she's usually talking about, so she can talk about what all is going on in HIV, STD, and hepatitis. So.
Yeah, I think that's a good idea because we see the numbers, because that's always part of our report, but I do think it's nice to see kind of real world what's happening, boots on the ground for us as a group.
Yeah, we'll do that. I'll surprise her with that right now. No, she will do it. And you know, stuff changed. There was a time where I would be able to do that, but not anymore because I have no idea. It's just completely new. Everything's different all the time. You said something the other day, she's like, no, we don't do that anymore.
So put away your slide rule, woman.
Exactly.
Thank you. Any further discussion? And my apologies, I forgot to ask if there was any public participation on agenda items. Is there any public participation on this agenda item? Thank you. Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. That moves us to approval of the updated enforcement policy, item 5 under H.
I'll move it and then another
Thank
question.
you.
Second.
Moved and seconded, so open for discussion. Julie, what can you tell us about the updated enforcement policy?
I cannot tell you anything about it, that's for
That's
Sarah.
me. Oh, Sarah, come on up here.
I mean, I
Sarah.
can, but you don't want me
I
to.
feel like we're-
want me?
Okay.
Just get right up here in the middle, get right up here. No, I'm
Yeah, on the floor.
No pressure. Okay, so the food code changed for the FDA, and so all of our enforcement policy for that was referencing the additional, or the one previous to that, so this is the update to that, to reference that. So I did a little memo that kind of talked about the changes that I did to it, added the definitions, incorporated the special processes in the new 2022 FDA food code. And so we took those out of the 750 code because we have enforcement with both of those combined for state of Illinois. And then we kind of re-established the inadequate food safety management system. So I didn't bring everyone's the food code for everyone to read, but
Thank you.
you're welcome. I was trying to save you and just give you the summary page for that.
What we had in the packet was signed 2018.
That is correct, because the food code changed prior to that and it had to go into effect for 2019. So then the new food code was adopted by Illinois again for this year for the 2022 FDA food code. So that was for the original.
Okay, so it'll be re-signed then with 2024 or 2025? Or
2024.
Or it will be the 2018 version?
Nope, this will be the 2022 version.
2022 version.
Yes, the other one was the 2018 food code.
They wanted to roll that out during COVID because we didn't have enough to do, so.
That's correct,
They thought
that's
that would be
correct.
great timing.
Yeah, and Illinois Department of Public Health requires that this is effective starting January of 2025.
But to be clear, you've been already doing it for how long?
We had the FDA food code, yes, that was the original one that we adopted in 2019, but they've adopted the most recent edition.
Can you summarize sort of what, if there are any significant changes?
There wasn't a whole lot, but special processes, which would include stuff like vacuum packaging, reduced oxygen packaging, that was under a 750 administrative code with Illinois, and they've adopted that new FDA food code. So Illinois can choose what sections to adopt, and so they adopted the special processes section in 2022. That was the biggest
Does that
thing.
involve the egg situation that I'm always fascinated by?
The eggs?
The balut or whatever it's called?
No, that's something else.
Looks like the veterinarians get that one.
Thank you, Sarah. Other questions for Sarah regarding the updated enforcement policy? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. Don't go too far.
I'm not.
All right. Thank you so much.
It's gonna loop right on to the next one.
All right, yes. Item 6, discussion of the placard ordinance and requirement for the county, and these are pages 85 through 93.
This is a special heads up to our new county board liaison.
Is it easy to go right to that page?
Yeah, I'm gonna pull those off.
Yeah.
It's 87.
85.
So I go way back with this when we originally adopted this.
Would you like me to give a real brief little
Sure,
thing? with
go for it.
Possibly Krista or Dr. Peterson hopping in. So, a long time ago, I can't even tell you the year, when Stan James was on as our liaison, he's the one that came up with the idea of doing the placarding of some sort. And the County Board of Health, we've worked on it forever, and they did Jim did all kinds of run-in, all kinds of things. Came up with, after a couple of years of messing with it, came up with the red, green, and yellow placards. And anyway, long story short, the county board of health, even though you're all the ones that came up with it and wanted to do it, the county board did not vote it in, so.
Was that an oversight or was that?
No, that was very intentional.
How long
You gotta,
ago?
it was a long time ago.
They
It
were
was-
not happy
Government's
with
controlling.
inspection.
Yeah, it was a long time ago.
Yeah.
But so what happened was CUPHD went ahead and adopted it. So it's mandatory in Champaign-Urbana that you have those up. Which is,
County is
in the county, it is not, because the county board, even though the county board of health voted it in a couple of times, the county board wouldn't pass it, and then we just, things
not.
happened.
We're gonna bring that back.
Yeah, things happened and we just never got back to it. And there was, there are people in the county who do post them. It's voluntary and they do post them because they think it's helpful to them. Where it's an issue is when a place, is shut down, with the red placard and they remove them. So in the county, they can do that. They can say, we're having a plumbing issue, we're having a whatever, we're on a family vacation, they can say whatever they want. But in CU, the red placard has to go up, and it has to stay up until it's able to be removed. And it is a good motivator, usually, to kind of get things moved along. Not always, but usually. So, we just had an example where they placarded with a red, and the restaurant took it down. Well, that's a problem, and eventually that would be a problem with the state's attorney, because that's like, no, that's a no-no.
Is
So-
that not published on the CU or webpage that people get those placards?
Well,
You
so
have to search
anyone,
for it.
yeah, anyone can go in and look at all the restaurant inspections. Nobody does usually, but they can, they're on there. And there are some people who do, but usually the media gets a hold of it because they know it's there. It's there because they FOIA us every day of the week for the stuff, so we just finally, they got it on the website and it's, people can get it now. But the deal in the county restaurants is it is not mandatory because it was never adopted by the county board, so.
Has that issue been revisited at any point?
It has not, because I cannot remember, what happened, and then when the board changed, it probably could have been brought back up, but it just wasn't, and then COVID, and then, so,
It's always perceived as too much government control.
It is.
And from our point of view, it seemed like it was a good thing.
Yeah, it
If passed your
is.
test, you'd like to tell people about it.
And it is, and a lot of places do it voluntarily, but, it's the ones who don't do it that are the issues to begin with. But, so, I don't know, so anyway, Sarah brought that back to see if you wanna take it to the county board again.
It's on the list.
All right.
Probably won't happen until January.
Yeah, I don't think that and they might want, they might wanna know more information and how it's been.
If you want to email me all the, not necessarily the history, but the actual,
Mhm. What it was and what the ordinance, because it's an ordinance.
Right.
We have an ordinance
Yeah,
for
so
Champaign-Urbana.
We will
Yes.
email that to you
Yes.
and how it would read, so you would have to adopt the ordinance, because without an ordinance, we don't
you
have
have
any.
no enforcement.
Right.
Yeah.
I would be curious, I still feel that it's worthwhile, and I would vote for it.
Mm-hmm.
I'm curious to know, it's a political question, and sort of a philosophical political question, and I'd be curious to know if you could get some perception of the caucuses.
It'll pass.
What's the current lay of the land? 'Cause
It'll pass.
Yeah.
if there's, like, if somebody said, and they're telling me that this
It'll
isn't
pass.
true, it'll pass, but if there was like a tweak that we would make it more palatable or something like that.
And ideally, we
There is
want.
a supermajority of Democrats on the board that pass.
Yeah,
He
we
wants
just.
to go out to eat and then find out later that, place has been closed down 5 times in 3 years because.
That's true.
And I mean, you have to search that out specifically to find that. It's not like we advertise it, right?
We
But at
never
a-
use it for like a negative
No,
thing.
but at a minimum, at least have, some kind of disclosure for the yellow and the red, right, with even consumers. But I don't have that right now. I can have a facility fail, 2 inspections and nobody knows.
Yeah.
And
So-
there are, there have been situations where there's been a foodborne outbreak in the county. It would have been probably nice if it was somehow tied to that, but we can't keep that information out of the media. We're not the ones who go to the media with it unless there would be a reason why we would say, if you have these symptoms, and you ate here from this to this, but we don't usually do that. It's usually somebody that works there that calls the media, or somebody that ate there, and,
Do you think that if somebody's refusing to do what they are required to do when they've been closed, is the state's attorney prepared to enforce the
yeah,
ordinance?
they
That's what-
do. Like in I mean, I can't say that for sure, because we've been through about 5 different people, but they're usually right there when we have any kind of ordinance issue, whether it's smoke-free Illinois or her stuff, they're always right there to, you know. Unlike some counties, we really do have, like, the state's attorney's office it actually responds to public health questions, and, well,
It's just the ghost.
just the ghost, getting the paper towels to come down. That's weird.
So what's the proper motion?
Well, I wanted to start at least the discussion.
If you want to do it, the next step would be to probably put it on the next agenda, and then to maybe her to get a caucus
Yeah,
and
I'd be
whatever you
curious to
say,
hear what you-
but, yeah,
I mean, I'd have
I think
to
you're
look at it.
probably right that it's
It-
time to bring it back up
Yes,
again, it just
and-
hasn't been.
Yeah.
And it would
was-
be consistent for both Champaign-Urbana
Yes.
Public Health.
Yeah, I had no idea because I
Yeah.
don't
Yeah.
tend to eat
Yeah, we
around
thought it
here.
was
so
Yeah.
I was-
Yeah, it is not.
If
No,
Champaign-
it isn't, and it's not, and there were only, I don't even remember if there was that much opposition, it was just like in philosophical, like, I can't remember, there was,
Oh, I remember.
There were
There
several
were-
food
Somebody
establishment
came
owners who were
in talking about the
That was
pajamas.
opposed to it.
Yeah.
I felt a lot.
That certainly would
Yeah.
do it. I did have
Philosophical.
Yeah, it's
issue.
philosophical
How much
issues.
control is government going to have?
Yeah.
And
Yeah.
you called it happened a long time ago, which now tells me how long I've been on the board.
Yep, because it was a long time
I
ago,
was
because
there.
we've been through,
Seems
I
like
mean,
just yesterday.
I can't even remember when Stan James was on the board, but
I
that's when it
remember, yeah,
was.
Stan was on- Stan
He
was
was the
on.
one that brought it up, of all things, and he was a Republican on the board, and he was, you know, and he
Well, his
had been
successor-
somewhere and thought it was great.
His
and-
successor, who I know,
I don't even remember
No, his
that.
successor did not
he
follow suit.
did not like it, and I know him, he's in Rotary with me, what's his
Oh.
name? Anyway. from Mount-
Brad?
I don't think he likes the board himself.
Yeah, too honest for him.
Yeah.
Call people Jamie.
Lyndon had a question.
Yeah.
I had a question, you know, it's,
Got it, you know, didn't like it though.
I agree that it's a good thing, so if I see closed, I know, okay, don't want to eat here because it's closed.
Well, you can't if it's closed.
True, I hear food
But I know why
safety-
it's closed.
Right, yeah, food safety alert.
Yeah.
But I've always seen satisfactory compliance.
Yeah, I only see the green sheet.
And I've only seen green sheets.
Yeah, it's rare that there are, the other ones are not that common.
I don't see it, but when I see satisfactory, to me, that's like a C.
Yeah.
Is there another word other than
I thought they had
satisfactory?
like their satisfactory compliance and then,
Outstanding.
Something.
Well, it's defined in our
Substantial and-
definitions.
I probably is. It's
So-
How about,
I was thinking we could do it like, you know, like 5 squares of toilet paper, like 20 squares of toilet paper, and then like a roll.
It's not good,
and they
right?
have a bucket.
In a bucket, go for the cholera.
You could call it safety compliant, or
But, I mean, if you look-
satisfactory.
I thought there was like a range, like it was satisfactory, substantial, and complete, or something like that.
Well, it kind of follows
is.
also definitions that they're used in FDA food code. So that's why we came up with those. Now, food safety alert, yes, you know, that's, caution.
Yeah.
So it's kind of like a stoplight, right?
But how long are those usually up? I
The
mean, that's-
yellow?
Until they're
yeah.
back in compliance.
Until their reinspection, which I have moved up
Yeah.
our timeline, so, 10 days.
Yeah.
And then if they don't correct it, of course, then they're
You can
they're
still
closed.
buy food in yellow establishments?
Absolutely.
Yes, you
Isn't
can.
that interesting? Well.
Yes.
But you can,
okay.
but it might
So
spark
at
a
your own
conversation.
risk.
It
It's
might spark a
It's like
conversation.
when you see the stoplight, you can speed up or.
You're either gonna go
slow
right
down,
up, that's right.
You better
And then
hurry
your
up
ba-
and eat here
And
before
then
they
your
close.
bowels are gonna speed up.
So can we put this on the agenda for next
Yeah,
week?
we'll put it on.
So I'll put all the stuff together.
And we'll send that out in the packet so that you and new board members can see what it is.
And I did not, I got an email that said, are you coming? And I said, yes.
I'm sorry?
Do you have any problem with any of the dates on the back for you to head out?
Just-
Okay. We'll make sure that we have the right email and everything.
No, yeah, no, I got the email, but are you coming? So.
No, yeah, no, it should be, okay,
So,
yeah.
there's no motion.
William has a question too.
Yeah, I just have one question. Is it gonna, if we expand it to the whole county, from an administrative burden or like, labor burden for?
No difference.
Or is it-
There's no difference.
They still
It's
get
just a
them, they
little
just
bit-
don't, there's no thing to post them, they're still gonna get them, they're gonna
Sure.
stick them in the drawer, but it's
It's just
required.
more also consistency, so it actually helped my staff as well, because they have to remember 2 different sets of guidelines,
Yeah.
right? So it actually helped us a little bit more, and also it kind of incorporates that enforcement policy that you passed as well.
To my knowledge, since there's been a county board of health, or county board of health,
Anything else? you
this is
want to
the
know?
first thing that has not passed
For
the
both.
same. Like, we always try to keep everything the same, I think this was the first thing that we just went ahead and adopted in CU that wasn't adopted. But we adopted it assuming that the county board was gonna adopt it, and then they didn't, and our board said we're still keeping it, so.
I do not see any, I can see maybe 2 members who maybe have a little bit of stuff, but I don't see anybody digging in.
And I also have kind of simplified the compliance, the satisfactory compliance. I had restaurant operators said that they don't like all those marks,
Mhm.
you know, on there, and the descriptions were odd, so I have simplified so that those I can also get you copies of as well.
Sure.
So that was kind of done for my restaurant operators as well, as consumers.
And I know one of the things that we also talked about, and I talked to a lot of the businesses, is that, you know, when you go like outside Urbana to St. Joe, or you're going to Savoy and stuff, then the people who are being compliant are kind of upset that the people across the
Right.
street aren't being, you know, so to speak, I mean, within a mile or so, and that, you know, they're still doing business without any of the regulations. And we dealt with a little bit of that too.
Yes.
You probably get those calls
Yes.
as well.
Yes.
And to make it even more weird, during the fair, even though the fair is right plopped in the middle of Urbana, right behind Carl,
Oh, they don't have them.
they are
They're
county.
County.
That
Because
is
it's county property.
It's county, so they are excluded from
Well,
that.
that's good to know after the fact.
Yeah, it's really interesting, but it's very confusing. So we have gone back and Sarah's changed policies so that we have our food licenses and things the same, permits, so
Yes.
that they're not having to be confused about that. And so we're trying
Yeah,
to
we
make
can,
it.
we can do that fix. Pretty, I don't see substantial pushback on that.
Okay, thank you. Is any other questions for Sarah? Thank you very much. We'll move that forward.
And if you have anything else that's like lingering in the corners,
I think that's the only, I think that was
That was
literally the only thing.
that wasn't consistent with the 2 jurisdictions.
And then it just got put on the back burner
Yeah.
because of, you know,
snowballing.
other things.
Yes, please.
That moves us back to the top of our agenda, so I am at item F, correspondence and communication. Julie, do you have any communication?
I don't, well, I will tell you that, we have a overflow shelter right now in the back of our building for Strides. They had about 20-some people sleeping on the ground outside of the facility. Yeah, so we have created, Rob and Jim worked their butts off on it to get that ready. And so we have like space for 22 in the back break room. They come here by bus at night at about 7, and then they go back in the morning at about 7.
This is a
Back to
low
Strides.
barrier shelter.
It's a low barrier. It's literally Strides. So they go through the intake and everything at Strides. We just provide the space. The staff is from another agency, and it's being paid for by another agency, so it's really, we cobbled this thing together. Cunningham Township Supervisor's Office did a lot to get this moving. All we're really doing is providing the space, and then, you know, the Friends of Champaign County Food Pantry is providing some snacks, and we put coffee and cocoa and things back there, and we got Rob, because he's fabulous at figuring out how to use the grant, figured out how to buy all that stuff for the cots and things out of one of our grants, because those will remain our cots following. We're also I don't know if you realize this, but let's say we had a massive snowstorm or something horrible happens, and we have, the police are pulling motorists off the interstates and stuff, the hotels fill up quickly, we pop up a shelter here, right in this conference room. And then they will come in here, you know, overnight until they can sort them out. Same thing, if something happens in an apartment, there's, something happens and, you know, we're a Red Cross shelter space. So, where are the Red Cross people, you ask? We don't know. We don't know. We used to work with them all the time, but they're not here anymore. So if something happens, you know, we work with EMA, and then Red Cross materializes and they staff the shelter and things like that, but we have it, and that would be, and we are also in charge of what's called special needs sheltering, should something happen, be it a tornado or any other thing. The last thing we did outside of Gifford tornado was the Katrina, when the evacuees were coming up from Katrina. So we just go there and we do all of our divisions basically do what they do, but over there. So if you need WIC coupons, they can do that. If you need, you know, if they got blown away by the tornado, if you need breastfeeding supplies or breastfeeding equipment, not supplies, if you need whatever, HIV meds, so we all work together as like a community with, because we don't have the doctors to do that, but we all work together. Whether it's oxygen or whatever people need, that's, we are the low barrier, not low barrier, we are the special needs shelter.
Did you do anything when that apartment complex got shut down for flooding all the time down here, like next door? basically?
No, we did not. In that type of situation, now, could we have, yes, if we had been called by Red Cross to do that, it has to be like, they have all kinds of rules. But with something like that, usually that is housing authority gets contacted, and they, if there's some kind of thing like that, they can get, are you talking about?
Remember where the gas station is now, there was an apartment complex, it was like condemned, but people were still living there, and it was like,
Oh, the old
raw sewage.
You know what?
The old motel. That became the apartment complex that that's not been replaced.
Like right here, like.
Yeah, you're talking about where the cook is?
Yeah, yeah.
Yeah,
Oh, that?
yeah.
Oh, no, we were sad that that went away, although we didn't like the rats, but we did like being being so close, and we would go over there. I mean, we had a lot of people we worked with over there, we were in there all the time. Yeah. So you're talking about the old hotel, yeah, that was better than nothing. I mean, the flooding wasn't good, but obviously. But so it's things like that, so it's very, there's a bunch of rules around the Red Cross sheltering, but this is a different thing that we're doing now. We've never done an overnight overflow shelter, but, you know, last night was the first night, and it'll go all the way through April. The people that are in there were already sleeping on the ground, so they have assigned cots now, they have their own cot, and they have a little plastic box underneath it for their goodies and whatever.
How is food handled?
Well, that's a good question, because I'm, you know, wondering, I think that they're eating over at Strides before they come over here, but I don't know that for sure, and we're having communication issues. I know they're eating, and they get breakfast here, like microwavable breakfast sandwiches. They get those on the way out back to Strides, but I don't know. We have snacks, but I don't know that there is any kind of, like usually the hot meal is at Daily Bread, and then they used to give, and I don't even know anymore, like sack lunches that you take, and then they would have overnight. So I need to check with somebody to find out what that is. Like, we can hook them up with, you know, munchies and things, but not, we don't have any.
Prepared foods and all those.
Yeah, we don't. Sarah would be all over me if I tried to start cooking back there for them.
Something, shoemakers, wives go barefoot, doctors.
Right.
Have a plan.
But, and just another thing that I thought was good, because the other directors are like having ideas, and Candy has asked if they would be interested in having a pee and flea station back there. And if you don't know what a pee and flea station is, that is where you can just come in and don't have to even see anybody. You just take the paperwork, you pee in a cup, you put the paperwork with the cup, you stick it in a little locker, lock it up, and we test it, and then we contact you based on your results. I've submitted 3 samples under your name, but apparently nothing. But anyway, it's, so she asked if they would like that set up back there, and the shelter staff said, yeah, that would be great. I mean, it's literally just cups in the bathroom with little paperwork, you pee in it, and we test for chlamydia and gonorrhea. And of course, if you have chlamydia or gonorrhea, we will follow up with that, and we will also pester you to test for HIV and syphilis while we action. There you go, pee and flee. And was there anything else on the, I think that was it, as far as correspondence, other than H5N1. Staff's like, dear God, don't talk about it, I'm just saying, keep an eye on it, because,
Is there like another case in
child is still, Canadian kid is still in intensive care on a ventilator. Doesn't sound good, it's been on a ventilator since the beginning of the month. Been again in November, so. Anyway, that's my excitement. That's it.
All right, thank you. Any questions for Julie? That
With
takes
that
us-
being said, if you
Okay.
have anybody who wants to provide food or snacks or anything like that, like you are with an organization or church or whatever, religious organization, they want to do something, let us know. Well, we've got 22 people back there, so.
Today's Giving Tuesday. All right, item G, Smile Healthy. So we have a number of reports here. We have August, September, and October's report. Those are items 4 through 9 in your packet. So I would entertain a motion to approve and place those reports on file collectively, or we can do one by one if there's any additional discussion on any of the other items.
I'll move to put them on file, all three.
Second.
Moved and seconded. Any discussion on the August, September, or October reports?
I actually, I think it was on them or on the invoice, and there was a discussion of progress in their recruitment and the like. I really appreciated that. Was more information than we had in the past. I appreciated that discussion, and I encourage you to continue.
We do have a representative from Smile Health here. Would you like to introduce yourself? Because I think you're newer to me.
Yeah, I'm Scott Dean, I'm the marketing and fundraising manager. And Lisa sent me all the reports that she did. I won't take credit for it because I didn't do it. But we are really trying to get more dentists and actually all positions. And it's a great organization. I worked there since February. Love to be there.
Thank you for being here. We're happy to have the partnership with them. And just so everyone, for the newer members that we have, over the last several years, we have consistently funded $50,000 to provide dental care services for children and adults in the county through Smile Healthy. And we've also, in the last 2 years, we've put additional funds towards recruitment and hiring of hygienists and dentists to meet a need in the county for more providers.
And exciting news, I can't remember, I think it was did we say it at this board meeting, but we hired a dentist.
You did.
We did.
Wow.
We were like, what? Yeah, Whitney got a dentist.
Starts
Yep.
January 6th.
Yep.
Very excited.
That is exciting, because we were like, oh my God, Francis Nelson is recruiting, and, we're never gonna get one, and lo and behold. And, so that was exciting. I also wanted to let you know that CUPHD leadership team and Francis Nelson leadership team has been meeting regularly to try to come up with partnerships that we can better coordinate and serve the community. And one of that is, which I won't talk about a lot, but is Public Health 3.0, which is like moving away from us doing services and us doing more of the public health macro type work, and having places that do that, like Francis Nelson, that can get higher reimbursements, having them do the services and hiring the staff and doing those things. So we are moving toward that, and we've been working with them, and it's exciting. And one thing that we are working on is having them be in the East Wing, lower level, where Avicenna Health Center is, so that they could be doing services specifically targeting women and children, women and infants. So, baby visits and prenatal visits and all that type of stuff. So they are looking at that, and there's a partnership somehow with Carl that they're working on. I don't know exactly what it is. I think it has to do with residents or maybe
Well, that
something.
small homes initiative off of Bradley
Yeah,
and
that's
the
it.
north part of Urbana.
Yeah, but this is specifically targeting like for maternal, more, you know, eliminating some of the
Maternal mortality and, yeah,
mortality.
infant mortality,
Yeah.
yeah.
But it's also just because, you know, when people come here for WIC, we have the big draw with WIC, right? And the giant child dental thing, so we have that big draw. But then if they need something else, we can't do it. So to have them using our space at below market rent, and then Avicenna can still use it on Sundays, because they only use it for Sundays. And then, you know,
I think that's
Can you send me more information about that? Because we don't have any residents anymore for,
it might not be residents, I
kids.
shouldn't have said that.
well, there's a residency for OB-GYN.
Yeah, that's what.
But
that's
there
what-
isn't, like, our family medicine residency is going west, and so we won't have family medicine residents anymore, and I don't have a pediatric residency here. But if there needs to be support for well-child exams and things like that, I'm their boss, so.
That's nice.
I mean,
Yeah.
I mean,
And
we should be able to come to the table to talk about partnerships that will benefit everybody,
Yeah,
especially when it comes to, you know, that sort of activity, because I would feel like a jerk if you guys were dumping time, money, and effort into women's health, and there's babies attached to that, and we're like, good luck to you, like, that's not cool, so.
okay. And that will be them leading that discussion because they're the ones with the providers, or we're
Yeah.
trying to get providers anyway. We're just, again, we're gonna be having the space and then getting our people over there, because, again, WIC and child dental, big draw. You know, we have a lot of clients in those, and to be able to then, and we have family case management, and we have doulas, and we have all this stuff, the breastfeeding program. So for us to be able to put those all together at all the places, and not just, you know, here, so it's exciting. And it's the first time that we have worked this closely with Promise or Francis Nelson in a very long time. So, it's looking good, so. They just need to get more providers hired, which, you know, get in line, I guess the whole world needs that, huh? Keep that in the back of your head, Krista. Keep it in the back of your head.
Working on it every day. Okay, any further questions, comments?
only a comment, I just think that is terrific. I mean, as
We're-
you say, Francis
we're excited
Nelson
about
can get funding,
Yep.
reimbursement in a way that you can't,
Yep.
that's good for them, that lets them be sustainable, that lets them grow.
It
It's
is.
good for the community, it's an appropriate role for them, and as you say, an appropriate role then for you not to have to provide the services. And I know it's been up and down over the last 30 to 40 years, honestly,
Yeah, I
but
mean-
I think that's great.
And public health, what we should be doing are the higher level, like and in fact, Community Health Partnership, who's up here, they are going to be, in July, we're gonna have them move out and go into a bigger facility. They need a bigger facility. They're always trying, they came to me and wanted to put a second story on, and I'm like, what? No, you know, you need a bigger building. So we're gonna facilitate them out. And then that's going to be Rob's division, because he has his staff scattered all over the place, so that'll go back. That, you may recall, that was Vito's office back in the day,
Yes,
all
it
10 of
was,
those
It with the
rooms.
big TV.
10 of those rooms, yeah. Big TV,
That
10
would've been
rooms,
Vito, yeah,
had a little
that's
toilet
right.
back there, the whole bit. So it's still there. So it will be more of, so what we'll be looking at is going and doing more of the, you know, screening and those type of things, and then getting them into existing programs, whether it's at Carl or Francis Nelson or wherever, so. There you go.
You get a big basement here too. You got
We
room.
do have a big basement. Occasionally it fills up with poo in one corner. We won't talk about that. It's really bad. We've had more trouble with this building.
So what did you get, a red one or a yellow one?
Oh, that would be,
Red.
that would be red.
Your category would be brown.
Yeah, it would be brown.
Brown.
You would not walk down there, yeah. I think it's finally gotten fixed, but it was hellish. Hellish.
So we have moved and seconded to place the reports for August, September, and October on file. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? That takes us to items 4, 5, and 6 under G, which are approval of invoices, Champaign County Administrative Services for our child dental access programs, and those amounts are $6,249.99 for each of the months of August, September, and October. So same thing with these, we could entertain to take these all in one motion, or we could separate them at the pleasure of the board.
I would approve of all of them.
Moved, do I have a second? Moved and seconded. Any discussion of the invoices?
I think these are also improved with breaking out the county versus the city.
Right,
Yeah.
and we had asked that, just for the new members, so Jennifer and Lisa have worked really hard through Promise Healthcare. Now, I think it probably applies in your lap as well, have worked really hard to demonstrate and show that in these reports, what portion is going to the county, so that we know we are always funding the county separate to what the health district is doing.
That should be
And just for the record, the dental is working really closely together as well. Both dental departments are working really closely.
So hearing no further discussion, any questions? Any questions for Promise? All those in favor?
Aye.
Anyone opposed or any abstentions? Thank you, everyone. I'm now at item H under CUPHD. We have the CUPHD invoices for July, August, and September. And again, these are typical invoices for all of the various things that we contract with CUPHD as a county for administrative services for payment, rather than having a whole duplicate department, adding another layer of things. So those are in pages 13 to 15. And same thing, I would entertain a motion to do these together, or we can separate them at your pleasure.
I'll second.
Did we, somebody?
Somebody first it.
Okay, moved. Okay, do we have a second?
I'll
Okay.
second, yeah, anyway.
Moved and seconded. Thank you so much, Amy. You do an absolutely amazing job keeping track of all of us and writing all that down, so I greatly appreciate it. Moved and seconded. Any discussion about these invoices?
I've always wondered what if we didn't approve them, what would happen? We've already paid it.
You would have to
haven't we?
claw the money back, I guess. The services are done, it's already paid, but, you know, I don't know. And that, you may recall, that was set up, like Deb Busey said, to go ahead and do it this way back in the day. And it makes sense, I mean,
Yeah.
it's,
You don't want to wait 3 months.
no, we'd rather not.
One day
so.
Dr. Peters is gonna vote no, and then he's just gonna stand outside the door of the club and say, where's my money?
Right,
Who's got
yeah.
my money?
Mhm.
Here's the letter.
Thank you. So moved and seconded. Any further discussion? Hearing none. All those in favor?
Aye.
Anyone opposed or any abstentions? That takes us to item number 7 under H, CUPHD reportable diseases and performance management report number 8. So these we traditionally, they're already on the website. There's a lot of tracking that currently occurs on the website as a part of the infectious disease department in the performance management reports. And those are the linkages that you have there. So we just, as a matter of formality, approve those as they're putting on, but it's a very similar kind of function. Champaign County is one of the few counties in the entire state, and probably one of those few with any of the NACO counties that does monthly reporting and tracking. So we're really in great stead here in that we can pull so much data out of our county that other people are not able to do.
And just wait,
Yeah.
just wait, what's coming? Which I tell them?
A community data platform that will have like 80 to 100 different health indicators that will allow folks to drill down to the census tract level.
Imagine Robert Wood Johnson or?
So we were looking at different models, so community health rankings, they've got a really good page, Healthy People 2030, they have a lot of different indicators on there. Our accreditation body also has a list, and it's a challenge for us figuring out, out of all of the indicators out there, which ones we want to select for our community. And we were trying to basically select indicators that align with our mission here for CUPHD and we're consistent across the board. So I think with that, we'll be able to, we're gonna end up with about 80 health indicators that we're gonna make publicly available to the community.
Yeah.
We can also add our own data to that system. So if we're working on a project with a community partner and they share data with us and they agree to make that publicly accessible, we can put that on our platform as well.
And we're already talking with the new coroner, and we're already talking with, we've talked to some of the new police chiefs about trying to get data from them, because they collect data all the time, and then being able to pull that type of stuff into this platform. And so remember how fabulous the dashboards were during COVID? Well, we're gonna have that for like 80 different kinds of things, so. Metopia, they all saw it at the conference and brought it back and went to the demo, and it's really cool.
It's
It's
pretty
called
easy.
Metopia.
Metopia is pretty easy to navigate. It's got like AI functionality built into the system, so all you have to do is type in, something of interest, and it'll take you right to where you need to go. So it's very user friendly.
So can we just like say that thank you to the folks that you have on staff that do that work? When I went in during COVID and like drilled down and looked at the data and even the reports that you send out, it does feel like next level compared to other places, and
It has to be in this community because of the U of I.
Yeah.
They do not want a canned report that you can't do anything.
Right.
And they knew at the very beginning of COVID, you better have more out there, because luckily, people in this community use it. I mean, they actually use it and do things with it, and the U of I everywhere, and if they have ideas of stuff, I would like to see some med data in there somewhere, because that is, we all know that is
Yeah.
where, no offense, but that's where a lot of the ugly stuff come from that we don't like.
Yeah, I noticed there was a huge rabies kind of jump in reportable diseases in the records.
And the rabies.
Not human cases, but those are just
Animals
individuals
that have been-
receiving prophylaxis for exposure.
Okay.
But
And last time when I had asked, I had mentioned that I could not get into the performance management.
that's why he's
And
here.
I was able to this time.
Oh.
Thank you. Is that because you did the two-factor authentication?
No, last time it was internal facing. We made that open to the public, so for forward and public consumption.
And we, the more stuff we get out there, you would be surprised how students will call up and say, they'll ask some question, and I'm like, I have no idea what you're talking about. Let me transfer you. And give it over to, but they do. We'll have students who are wanting to do a project on it, and professors that'll call up and want more information about stuff, so.
it's a level of reassurance, I think, to feel like there's a transparency, like you might not be able to fix everything, but you at least have eyes on it, and the public facing part of that can see that. I feel like there's a level of reassurance there that's just different than other places. So it's a, just know that it's appreciated.
Good.
And
And that's his division that's going to be expanding, so, and the I-plan's getting better and better too, so.
So you know how you send all the COVID data to CDC now, and you don't publish that? Could we maybe pull that back?
We don't get it, it's no longer reportable.
Yeah.
So we don't have it. We only get our data from, it has to be reportable. So we get, like, what do we have, like 85, 100 some diseases that we get data on. But COVID we don't, because it's not.
We do post, so there is a report available on our website. We revamped our website recently, Amy, could we pull up our website really quick just to show folks?
Fancy. That is fancy.
Okay.
All right.
So it's under
New
reports and
website.
data in the blue ribbon at the top.
At the very end.
Far right.
Yeah. So we publish a
The
respiratory
respiratory.
illness weekly surveillance report. And that covers the 3 big viruses, so RSV,
Right.
flu, and COVID.
Yeah, the same ones that are done with the water, wastewater.
Yeah.
testing.
So it's separate from the wastewater reports, those are also available.
Mhm.
But we source information from syndromic surveillance system, and we also get some data from our local hospital labs. So we'll report on test positivity in those reports. We are a little behind with the holiday, but you'll see that our last report was for MMR week ending November 9th.
Just a new one.
MMWR week.
So, since you're doing
We
this,
don't get the, like we did during COVID, where we had all that information coming in, and we could separate all that
Yeah,
out.
but who's sending it to? If it's first versus, where is it? Who's coordinating it?
It's coming from the, what is it, the hospital system, or?
Right, so so the syndromic surveillance data is sourced from the hospital emergency departments, so we can, like in the report, you'll see,
It's basically
information about
ILI.
hospitalizations for children with RSV, individuals with flu, and individuals, with COVID, and then we also do some breakdowns as well, so you might see a demographic breakdown as well for that.
Okay, and then, so the walking pneumonia thing, cause like, I don't know how many people
We were just talking about.
I have run
yeah.
into,
Mhm.
who
There's
were
a
like,
lot
oh
of-
yeah,
It's
it turned
not-
out to be walking.
It's not really walking pneumonia
What,
this year.
mycoplasma?
It's, yeah, it's the organism that causes walking pneumonia or atypical pneumonia, but at least the kids anyway are sick. Like,
Yeah.
you would never see a kid in the hospital in the past with mycoplasma pneumonia because they cough for a month and just feel crappy.
Mhm.
But we've had lots of kids test positive for mycoplasma and end up, on pretty high levels of respiratory support.
Yeah.
And then, stay in the hospital for a few days before they go home. So it's weird this year, but that's actually not all that uncommon with the individual organisms that cause respiratory illness, because about every 3 years we'll have a really bad RSV year. And that's just because the strain that comes through is a little bit different and causes more severe illness. And, you see them test for flu, RSV, and COVID, but literally that's the tip of the iceberg. So the kids that have been to the hospital, many of them don't have any of those three,
Right.
but they'll be positive for rhinovirus, enterovirus, or human metapneumovirus. What's another one that's bad right now?
Do you-
Parainfluenza virus 3.
Do you do the respiratory panel on all of them?
No.
Just, they have to be like
And if you're
really sick?
if we're following the AAP guidelines for bronchiolitis to the T, they should not get any labs or
Mhm.
any imaging, because you diagnose bronchiolitis with your eyes and your ears. And that respiratory panel that you're talking about, which tests for dozens of different things,
We love those,
it's like $1,600.
Per
So
but we love those.
they're great because
Yeah.
parents love to know, oh, my kid's sick because of this,
Yeah.
it's named.
Yeah, it's a PR thing, and the child will come in, you'll use your clinical judgment, and then the parent will leave saying they didn't do anything.
Right. Well, and on that panel, there's really only 2 or 3 things that I can treat: pertussis, mycoplasma,
Yeah,
and
that's the other one,
influenza.
that's,
Pertussis
there's
is-
an outbreak at the college right now, and that's just crazy.
That's
There's
because
more than that.
anti-vaxxers.
Well, anti-vaxxers and our immunity to pertussis wanes over time, so that's why there's a Tdap now instead of just a TD for the tetanus booster. They put pertussis back in it because we figured out that, everybody that's coughing for 100 days, they have pertussis. It just sucks for 100 days because the Chinese word for pertussis in the Chinese language means 100 days of cough.
Yeah.
Oh.
Oh.
Yeah. So what is the community level of up-to-date on Tdap, which is, the ones for flu and RSV and COVID right now are pretty horrendous.
Well, you mean the vaccination rate?
Yeah.
So that's another thing we don't really know.
Well, aren't those, at least the public school kids, those are.
We get those through the schools, we know that, and it's going down. Again, Champaign County is more vaccinated than a lot of the counties, and there are certain schools that are not, as vaccinated. But, I haven't looked at it lately, that's usually a Brandon thing that
If we
you'll
get
come
a
in with
case
it.
in a school, we'll look at it.
But
But that's all available on ISV's website. And last year, IDPH published COVID vaccination coverages at the county level. They haven't updated that for this year yet.
And, yeah, it's, I really don't understand why the rates are going, dipping so low nationwide this year for flu and COVID. And the flu vaccine this year is at
Actually,
night
it's
rate
higher
of
this year than last year
Yeah.
for COVID, which surprised me.
Is it? Because that
Not by a
was,
lot, but it was like 21 to 37. Yeah.
and there's hardly any kids, which, I don't know about that.
All somebody has to see is somebody who gets tetanus
Yeah.
Well,
to
you would-
decide
one
that
would
maybe you
think-
might want to be vaccinated for it.
One would think, but the person that had the 6-year-old out in Oregon or wherever that almost died from tetanus, and the state stepped in, and the parents still wouldn't vaccinate him after they got it the first time.
Wow.
Wouldn't give him any vaccinations after that. It's
They
like,
use immunoglobulin?
well, but there's other things. Tetanus is diphtheria, pertussis. God help us if we ever get diphtheria.
I don't think you see that anymore here.
You don't see it now.
They've seen it in some of the former Russian
Right.
countries, because one good thing about communism is they had, government programs that vaccinated, so when they, all broke apart, the vaccination programs broke down too, so they had outbreaks of diphtheria in a lot of those former Russian republics. And Tdap, just to back up to that, one thing we do is we catch pregnant females whenever they're in for their prenatal care, because that's one thing.
Protects the infant,
Yeah,
right?
yeah. So that does help a little bit, because then sometimes we can strong arm a dad into getting their booster.
Grandparents stepped up.
Grandparents
They
too,
really
yeah.
stepped up. That was the thing I noticed when they came up with pertussis and that. They added that. Then grandparents all of a sudden were like, oh, we're gonna protect the grandbaby. So that was a good thing.
My grandparents old enough to remember when that was.
Yeah,
So
exactly.
hospitals
Oh,
wouldn't let
a lot of
grandparents visit unless they
Yep.
could show that.
Yeah.
But if we're gonna have this new system, and even maybe before that, would it be possible for you, somebody to sort of bring highlights from what that data has gathered for the last quarter, since we sort of meet quarterly, so that if there's some
Once it's up to
significant
date.
trend or.
You could give a demonstration.
Mhm.
Right,
That would be
and I
interesting.
would think, I'm not gonna go out and dig through it, but I would like somebody who is
You will
putting
be,
it all
I
together to
bet
bring
you'll be
sort of.
surprised how much you do look at it, because
Well,
it's going to be something that is, that you can look at and understand and be like, oh, this is interesting. You don't have to dig down into it, but in this community, there's always people who will, but, it will be something that will be, you will probably just wanna look at. But yeah, we can do that, and we will certainly bring in things that are of new interest and.
Well, I think we should give you an opportunity to show off a little bit, like, if
Yeah.
you've done all this work. Give
And
you an
I
opportunity
would
to show
also
off for it.
encourage you to, or if you were okay with it, I can bring that to the board, because we've been talking about having various departments come in and do like a little show and tell what they're up to.
Yeah.
And I would love to, show your tax dollars at work.
Well, plus then we would be educated, and even if we don't, like you said, dive into it ourselves,
We know it's
we'll
there.
know about it. And if somebody's
Right.
asked, just, when you go to the bar and somebody asks about public health, you'll be like, oh, look, I learned about this thing, and we can pass it along.
Well, and.
But you should get a chance to show off if you work so hard on something.
We'll
like
put it
that.
on the March agenda.
If we have what you said about somebody having their eyes on it, it seems to me as a board, we should have our eyes on it. And instead of each of us having to go look at it individually, if you who have your eyes on it could come and tell us on a quarterly basis, here's what I'm seeing.
Mhm. Yeah, well,
Could
the
be.
Tokyo show.
Yeah.
Thank you. Any other discussion? Hearing none, we're voting on the CPHD reportable diseases and performance management reports, placing those on file, items 7 and 8. All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. And then, that takes us to update on the county sexual health education program. Whitney, take it away.
I thought that you stopped all sex in the county.
Yes, I did, successfully. No, we are wrapping up this calendar year. We've completed programming at Rise Academy in Rentoul. That's the new alternative Thompson Learning Academy. It's the new Thompson Learning Academy. Fisher Junior High with their 8th graders, Fisher High School with the 9th graders, and then the 8th graders at JW Ader. We did have 2 of our health education staff leave this year, one in August and one in November, so we're hoping to get, well, we have hired those positions, they start in January, so we'll be able to secure some more of the county schools in the spring.
Any additional information? I know you're working on Heritage, Muhammad.
Not Muhammad, Heritage, Ludlow, Thomasboro, and hopefully Gifford as well.
Is there any, do you guys have any kind of like standards or guidelines for sex education for the public schools?
Yes.
Okay, so if somebody is teaching and they're not following those guidelines, hypothetically, who would that go to?
Illinois State Board of Education.
Yeah, I was just gonna say, we go in and teach it like it's supposed to be taught.
Right.
And if somebody says, you can come in our school, but you can't do this, or this, then we're like, no,
Yeah.
you get somebody else to do that. Cause yeah, there are standards that.
In Illinois, if you do teach sex ed, you have to do it a certain way, but you don't have to teach it. But if you're going to teach it, there are rules about how you teach it. And ISB enforces all that.
And it does not involve puppets.
Does not involve licensing, not anymore.
Yet.
Missed them. Any other questions for Whitney? Thank you for everything you do, greatly appreciate it. That takes us to agenda item I, old business, update on long-term care beds in Champaign County. Kathy, do you have any report on this?
I do. What I really have is a presentation I'm not going to give tonight, but from our consultants. And because this body funded that study, I feel like it's something that we should get to see. I don't think you want to take the time tonight.
Is it, you can put it on the, whatever, or just send it to
Yes,
us?
yeah, I can. And part of our agreement with the consultant said that we don't share broadly, but it should be shared with this body. I just would ask that you not share it anymore broadly. So if I can do a little background, especially for some of the new board members. So we have a crisis in our county, and Julie acknowledges.
And worse.
In that we don't have enough skilled nursing beds in our community. And we're one of only 2 counties in the state of Illinois where that is the case. And we learned about it.
What's the other county?
I think it's Will County, but they're only short 10 beds. We're short 300 beds. So the Department of Public Health, Illinois State Department of Public Health says that we should have for our population about 700 beds, 711 I think it is, and we have 400, so we're short over 300 beds. So it's not like a little shortage, we're almost half of what we need half, or just slightly over half of what we need.
And we're not turning the conference room into a long-term care
No,
facility, even
that's what we don't
temporarily.
want to do. And thanks to the county board and this board, we were able to get some help in defining that need. There was a group of us, that was a grassroots group that knew about it because we had spouses who needed long-term care. And what we were finding was when people were being discharged from a hospital, I have a friend who had this happen just this past fall. She was told, okay, you need some rehab care, but there's no place in town for you. You'll have to go to Gifford. And she's 87 and her husband's 89. She said, I can't go to Gifford, I can't drive, they'll never see me. But it's not only a matter of companionship, it's a matter of either not having appropriate facilities. So when the grassroots group got together, because I had worked in health care, I went to both Dr. Leonard and Carl, who had been my boss and CEO at OSF, and said, are you guys seeing that this is a problem? And they both said, yes, it's a really serious problem for us, and we're keeping people in the hospital longer than they should. OSF said this is costing us $3 million a year, and patients who are staying in the hospital, and when they leave, they're not necessarily going to the right places, they're not getting the care they need, they end up back in the hospital, it's an issue. And so we felt like we needed, and so we formed a group called the Advocates for Aging Care. And we now number over 200, again, thanks a little bit to Public Health who let us go be in their booth during the farmers market. But it was a significant issue, and again, thanks to Public Health, Robert led a survey which was funded by the county board where we identified how significant the problem was, and even in the fact that I think we were looking for 300 people to respond to the survey, we had like 800 people respond.
Almost 1,000.
Yeah, and there was just, it's such an issue for people. If you are affected, if you aren't affected, you just assume that when you need it, it's gonna be there, and then you get surprised at a difficult time. So we thought, okay, we're gonna go out and we're gonna open a nursing home. Well, it turns out that not only is that financially difficult to do, but the state of Department of Public Health has a moratorium on opening skilled nursing beds in the state of Illinois because everybody else is getting access. We're the only people that have a shortage. So we did this, Public Health did the survey, and honestly, I think some of those results should be brought. Did you present that here? You did not. The result of
I
that
did
to
to
this
the
group.
county board, but not to this.
And then we felt like we needed a little bit more information, and we learned that people don't open new freestanding nursing homes anymore. Not only can you not do it in the state of Illinois, but across the country, people aren't doing it, they're closing nursing home beds. As Clark Lindsay in our community used to have 105 beds, and they reduced to 49 beds. And when I went to her, that CEO who I've worked with in the past, did a fabulous job, I said, why would you do this? This is where everybody thinks they're gonna go. And she said, because we can't afford it anymore. We are finding that the residents in the independent living at Clark Lindsay are supporting financially this nursing home for the community, and that's not right for us to be doing that anymore. So now we're gonna just have a nursing home that's big enough to support the people who live at Clark Lindsay. And we learned that that was kind of the trend throughout the nation. That many retirement centers who had nursing homes are reducing them. Many nursing homes are closing. In our community, there are Medicare rates nursing homes 1 to 5 stars. We have 2 1-star facilities in our community, the lowest rating. The only one that is better than that is Clark Lindsay's, Meadowbrook, and Gifford. Gifford has, I think, a 3-star rating. But that's it. So we got some funding, again, from this board and the county board to hire a consultant, a national consultant, who works with not-for-profit organizations across the country in long-term care. We know and had done enough research to know that there are plenty of good for-profit nursing homes, but as a general trend, not-for-profit nursing homes are more highly rated than for-profit nursing homes. And in the state of Illinois, because we are the 49th worst state in the country in terms of Medicaid reimbursement, it's a very hard state to do long-term care because the reimbursement is so bad for Medicaid patients. So places that sometimes do long-term care don't really want to come in and do it in Illinois because our reimbursement is so low. So we hired this
Just
consultant,
hang on,
Grace.
Kathy, it's gonna get worse.
We hired this consultant, Grace Stone, the national consultant, and that is the report I would like to bring. I don't think we want to do it tonight, but I'd like to do it at the next meeting. We just got an updated report about 2 weeks ago. And we said, and they came in to say, okay, we knew what the need was from survey results, but we wanted to quantify that so we could go to a developer, a not-for-profit developer, and say, how about developing something in our county? So they came and picked there was an organization called Heritage Enterprises. They're the ones who manage the Gifford home. And I had worked for them for a couple of years, and I went to them and said, what would you think about coming to Champaign? And he said, we've just gotten out of the nursing home business. We owned 33 nursing homes in central Illinois, and we've just gotten out of that business. And I said, why would you do that? You ran great for-profit nursing homes. And he said, because we can't do it anymore. The Medicaid reimbursement is worse. The Medicare Advantage is causing a real problem where it used to be that we would make our money on Medicare patients. Now Medicare Advantage is not letting people stay in as long, they're not paying as much, and they're not even accepting some patients. They won't let you stay in the nursing home, which was really what I ran into with my husband. They said, we're not going to do that anymore. We're going to manage nursing homes, but we're only going to manage not-for-profit and government-owned nursing homes because we think those are the only ones that can do a good job. So I had originally thought that they might be a possibility for us. So then we said, all right, we got to identify a good not-for-profit nursing home operator who will look at opening something in Champaign County. and we hope that this consultant will help us with this. Well, they came in, they do the demographic analysis and talk to competitors, and here, the punchline that they came up with was, you have an incredible need for skilled nursing beds in your community. Yes, you need at least 300, you're probably gonna need like 350 as the population is aging. You have some need for independent senior housing, and you have not much need, but a little bit of need for assisted living and a little bit of need for memory care, but not very much. And what they said to us, and we had learned it, is the way this works is the way organizations, not-for-profit organizations, are able to support skilled nursing facility is by building a continuum of care and using the independent living and assisted living, as Clark Lindsay does, to financially support the skilled nursing facility. So if you want to have a new skilled nursing facility, that's really the way to do it. And it turns out that the State Department of Public Health also says, we won't let you build any skilled nursing beds unless you do it as part of a continuum. If you do a continuum of care, then we would approve some skilled nursing beds to support that continuum of care, independent assisted living. So the consultant said to us, you need to partner with somebody who, and they said, if you're gonna build a facility that will support financially the skilled nursing, and if you wanna do 40, 50 beds, nobody's gonna come in and do 300, then what you need is probably 200 bed independent living units to support the skilled nursing financially. And they said, you probably don't have a need for 200 independent living units in this market. You probably have a need for 75 to 100. And so their advice to us was, go work with somebody who's providing one aspect of the continuum of care and talk to them about expanding. And I had been talking to Carl because many years ago, the Windsor Savoy was my project. And every year when I was at Carl, we would say, do we want to really still keep the Windsor Savoy? So I went back to Dr. Leonard and said, are you still thinking maybe of selling the Windsor Savoy? And he said, you know, we would think about selling that. Well, as you probably all know, they did decide to sell it. So, and I said to him, so if we could find you an owner, would you consider that? And he said, yeah, but we're shopping it too ourselves right now. And I also went to Clark Lindsay and said to them, would you consider expanding? Maybe you'd like to have a satellite in Champaign. Because you have you know, they're all filled up. They've got their new facilities and they're already all filled up with them.
It's a waiting list.
There's a waiting list already,
Yeah.
that's right. And she said, it's a tough time for us to do that because we're growing, but yes, we would consider that. We'd look at that if that turns out to make sense. So then, in the meantime, Carl worked with this company called Greencroft and sold the Windsor Savoy to Greencroft. Greencroft is a not-for-profit, faith-based organization out of Goshen, Indiana, and it just so happened that the day I learned about that, the next day I had a family reunion with members from Goshen. And I said, have you ever heard of this organization? And they said, oh yeah. And I said, what do you think of it? And they said, it's the place everybody wants to go. It's a great place. So Carl, providing an introduction for me to talk with Greencroft, and I said, we think there's a big need for skilled nursing. We also know there's some need for independent living and expansion and a little bit for assisted living, and we want to support you in doing this because we looked at their facilities, and all of their facilities, and they have like, I think 11 of them. Most of them are in Indiana, one in Ohio, and one in Michigan. Almost all of them have skilled nursing with them, so they have the continuum of care. And I said, do you accept Medicaid patients? And they said, we do, in all of our units. But they said, Illinois is a different story. And what we can do in other states, we can't do the same in Illinois. So our advocates for aging care are set to meet with them in January. We've since met with the Mennonite group, and the Mennonite group, it's faith-based, but it's kind of loosely faith-based. But they take some leadership in each community, Greencroft does. So they're looking for board support and local involvement. And the Mennonite community is, you know, they're like some of the rest of the church groups. They're an aging group, and they're already finding that they're running into these problems. So they're very supportive. The other nice thing that's happened is we've developed a really some excitement from the university. So the dean of the College of Engineering, when we went and talked to him, he said, oh yeah, there's a big problem here. I'm bringing my mother, and there's no place for her. And dean from the College of Applied Health Sciences didn't have that issue, but knew that it was a problem. And now the dean of Fine and Applied Arts has been involved in a project like that in Arizona. So we're looking, the other trend in this area is working with the university. So we've got a university group who's interested in looking at developing, bringing new technology to developing a skilled nursing facility, which we don't have in this community. We haven't built a new skilled nursing facility for a long time. And they're interested in using their technology. We've gone to a couple conferences with them and looked at some of the technology that could be used in a skilled nursing facility. And they're interested in being involved. So our hope is that Greencroft will look at doing something like this. But the only way that we can do this effectively, and everyone who we talk to about it for Illinois says, we've got to have some other sources of revenue. One other source of revenue is the independent living. Another source of revenue is a foundation that raises money. And then another source of revenue that we are knocking on the doors of is the fact that in our community in 2006, we had a referendum that was passed to levy a tax for nursing homes. That tax was raised and used for the Champaign County nursing home. When the Champaign County nursing home closed, the taxes were used to pay some of the debts that were incurred by the county in supporting the nursing home. Those debts are paid off by 2025. And we talked with the county administration about would those funds be available to support a not-for-profit nursing home that would accept Medicaid patients. And you know, the county's working through their own financials, but we believe that there's an opportunity for some of that revenue that could be used for a not-for-profit that could accept Medicaid patients. And both hospitals said, if you can provide a long-term care facility that will give us some of the services we need for some patients, like cancer patients who need high-cost infusion drugs, that nursing homes won't take those patients because they don't get the drugs paid for some bariatric patients, for some complex medical patients. Pardon? Yes, well, not LTAC probably, not that far. But even some additional respiratory or some dialysis patients. There's no place in town, skilled nursing facility, where you don't have to get transported out for dialysis. So they said we would look at the possibility of providing some financial support for people. We can only do it if it's a not-for-profit. So our goal now is to look at how we can work as a community, university and the community, to get some resources to make sure that we could support a not-for-profit that will accept Medicaid patients in developing a skilled nursing facility. And our first step is to try to have those discussions with Greencroft. We think that's our most likely opportunity. If Greencroft says, and they have said, we don't know if we can do this in Illinois. Yes, we've done this in other places. They're not saying no, but they're saying we really have to stop and look at it.
So who sets Medicare reimbursement? Is it the assembly?
The Medicare reimbursement rates are set by the
Medicaid.
Oh, Medicaid, they're set by the state.
Who is?
How far off is Illinois' Medicaid reimbursement from realistic?
I probably can't accurately respond to that anymore. Some of my information on that is old. But it used to be that in the skilled nursing facility, they covered about 60% of the actual costs. Not the charges, but the costs for bringing. Now that may be different, and in some cases now, for instance, Accolade, which took over the old Carl Arbors, and I talked with them about they're for-profit, so they can't do some of the things we would like them to do, but they're working hard to try to provide a better facility. But if they stay at a threshold of, I think it's 75% Medicaid, then they get a Medicaid reimbursement boost. So they have more than 75% of their patients are Medicaid. And so they get a little higher payment with that. But where they make their money is, or used to, is on the Medicare patients. But they're doing everything they can to maximize the Medicaid reimbursement. And my understanding is skilled nursing facilities says there are opportunities to do that. But it doesn't cover even costs, actual costs, not just over allocated costs, but actual costs. but I can't tell you right now how much.
Well,
it
you know,
is.
one wonders if Medicaid reimbursement is a problem probably throughout the entire state of Illinois.
It is.
Might there be some possibility of statewide increase in reimbursement?
Well, there are associations who work on that every year. Illinois Healthcare Association, which is responsible for nursing homes, works on that every year. IHA, Illinois Hospital Association.
All right.
Yeah, you guys, we
Thank
need
you.
to.
Yeah, I'm so sorry, so people have to leave.
Right.
Yeah, I got it.
Thank you. We have, thank you very much. We'll put that on the March agenda.
Okay.
Thank you for everything that you've done, Kathy, and certainly for giving everyone that rendition of everything that you have done for such a long time, so we greatly appreciate all those efforts. Our last agenda item is approval of the Board of Health meeting schedule. One thing, the meetings for next year are March 18th, June 17th, August 19th, and November 18th. I do have a conflict for the 18th, that is spring break week for you at UC. You probably have to. And I'm in DC actually for a conference at that time. So I'm wondering if March 11th might work better for people.
That's a Tuesday, right?
Yeah, it's a Tuesday, because Tuesdays consistently seem to have worked for others. Do the Tuesdays kind of work for you
I think
too?
anytime we tried to move it off Tuesday, it's been a conflict. All right.
Well,
As far as I know, I'm okay with the 11th.
Okay. And then the June 17th, August 19th, November 18th. Any issues with those? Thanksgiving week will still be at the end of the month. I kind of check through these, make sure we weren't on any holidays or any other kinds of weeks that would interfere with calendars, but. So I just need a motion to approve then with the change to be March 11th, June 17th, August 19th, and November 18th.
I move to approve the schedule with the one change.
Thank you. Moved and seconded?
Second, with the provision that it'll probably change again.
I'll be in history tells us everything.
I hope not. All right. Thank you so much. Moved and seconded. All those in favor?
Aye.
Anyone opposed? Any
I'm gonna
abstentions?
make my sixth grade
Okay.
violin.
Last thing I need, any public participation on non-agenda items?
Any public?
All right. So the next meeting will be March 11th. I just need a motion to adjourn, guys.
Motion?
Been moved, second, do I have a second?
Second.
Moved and seconded. Any discussion? None. All those in favor?
Aye.
Anyone opposed? Any
Those
abstentions?
opposed can sleep here tonight.
Okay. Thank you so much. Thank you, everyone. Very nice to meet you.
Bye.
I have to leave at 5 a.m. for New Orleans.
Oh, you do? Oh,
It's
oh,
70
man,
there.
and the tears are just flowing.
I have a, I have a conference. Well, I am going to have to get